Hello. I'm Dr. John, and this is the channel where health and education meet. Have you ever stopped to think about the color of your urine and what it might be telling you about your health? Believe it or not, the color of your urine is more important than you might think. In this video, we'll explain how a simple change in color can indicate anything from dehydration to serious problems like urinary tract infections or kidney diseases. Did you know that, often, your body tries to alert you before any severe symptoms show up? Stay tuned because in this video, you'll learn how to monitor your health in a simple and practical way by just observing the color of your urine. Have you ever noticed that your urine seemed darker than usual? Or perhaps you've noticed that it looked a little cloudy? If so, this could be a warning sign, and it's crucial to understand what it means. By understanding the signals your urine is sending, you can take preventive measures that will make a huge difference to your long-term health. Don't forget to watch until the end, because the information shared here can help you avoid diseases and adopt healthier habits. Healthy urine is typically a light yellow color, something many people might consider trivial, but it's actually a direct reflection of good hydration. When you're well hydrated, your body can efficiently eliminate toxins, and that's visible in the color of your urine. If your urine has this hue, it's a sign that your body's functions are operating optimally. Remember, urine can vary depending on how much water you drink, so if your urine is clear, congratulations. This means you're taking good care of your body. Now, imagine you've just exercised or have had a very busy day, and when you look at your urine, it still has that light color. This can be confirmation that you've reached the balance needed in your fluid intake. In this context, observe the small changes in your body as a thermometer, not just something that passes unnoticed. The color of your urine, when healthy, is almost like a barcode of your health. Understanding this is a simple yet powerful step. Maintaining a normal color in urine is simple. Just make sure to keep drinking liquids throughout the day. Water, tea, even natural juices can help maintain a healthy color. However, some changes might occur, especially when there's insufficient fluid intake, signaling that your body needs more water. And here's where the next question arises. What happens when urine starts to darken? If you've noticed your urine is darker than usual, you might be wondering, is this a sign of something serious? Well, the answer is simple but very important. Dark urine, especially when it turns amber or even brown, is often a sign of dehydration. This happens because, when the body is low on water, the urine becomes more concentrated, carrying more waste, and taking on a deeper color. It's not something to ignore, as dehydration can affect many vital functions, from digestion to kidney performance. Now, imagine you're in a busy routine, running from one place to another, and you forget to drink water throughout the day. At night, when you notice your urine is darker, this could be your body's alert telling you, hey, I need more fluids. If you often find yourself in situations where you feel thirsty, stay alert, as your urine might be telling you that the necessary balance is missing. Don't ignore these signals. Simple changes to your routine, like carrying a water bottle with you or adding more liquids to your meals, can help prevent these episodes. Most importantly, dehydration doesn't just affect your immediate well-being, but it can be the precursor to other issues. If left unchecked, it can lead to more serious problems, like kidney stones and even urinary tract infections. What can you do to avoid this? The answer lies in simple actions, like ensuring you drink regularly, even when you don't feel thirsty, especially on hotter days or after intense physical activities. Now, if your urine continues to stay dark even after drinking more fluids, it's time to dig deeper. When urine turns red or pink, the shock is immediate, right? While the first reaction might be worry, it's important to understand that this doesn't always mean a serious issue. In fact, red or pink urine can be caused by several factors. The most common explanation is the presence of blood, which could happen due to small injuries in the urinary tract or even the bladder. This can be caused by intense physical activities like running long distances or by a minor trauma, such as a small fall or impact. However, it's worth noting that in many cases, red urine has nothing to do with blood. Foods like beets or blueberries, for example, can temporarily turn the urine pink or red. If you've just consumed these foods and noticed the color change, there's no need to panic. However, if the color change persists, it's time to pay more attention to what's going on in your body. This is because, in more serious cases, red urine can be a symptom of severe infections or more complex issues like kidney stones or tumors in the urinary tract. So, what should you do about this? The most important thing is to observe the frequency of this change. If the red or pink color disappears after a few hours, especially after consuming food, there's likely no cause for concern. However, if the problem persists, the best thing to do is seek medical advice. Only a specialist can conduct the necessary tests and rule out any serious conditions. Now, what comes next? Urine with different hues can signal other conditions, like when it gets darker, right? When urine turns a dark yellow hue, many people wonder, is this normal? In general, dark yellow can be a sign of mild dehydration. This happens when you're not drinking enough water, causing the body to concentrate more waste and produce a stronger, more pigmented urine. If you notice this change after a long day of work or a period without adequate fluid intake, don't worry. In many cases, the solution is simple: drink more water, and the urine color will likely lighten within hours. However, when dark yellow urine persists for several days, even with increased fluid intake, it may be a sign that something more serious is going on. Certain medications, such as those used to treat urinary infections, can cause this color. Additionally, liver diseases, like hepatitis, can also affect the urine's hue. It's important to observe other symptoms, such as abdominal pain, fatigue, or jaundice, the yellowish tint in the skin, which may indicate a deeper health issue. Pay attention to these details. If you're wondering what to do when you notice urine of this color, the initial recommendation is to increase water intake, especially if you know you've been drinking insufficiently. But if, after doing this, the urine is still dark yellow and other signs appear, a medical consultation is crucial. The most important thing here is not to ignore lasting changes and always act preventively. After all, as we've seen, simple changes in urine can reveal a lot about your health. But is clear urine a good sign that everything is perfect? You might think that when urine is completely clear, everything is perfect with your body, right? Well, it's not exactly like that. While clear urine generally indicates that you are well hydrated, it can also be a sign that you are drinking too much water. This may seem like a healthy thing, but excessive water intake can dilute your sodium levels too much, causing an imbalance known as hyponatremia. This condition, although rare, can lead to symptoms like nausea, headaches, and, in more severe cases, even seizures. Another point to consider is that clear urine can also be a sign that your renal system is functioning excellently, as it is successfully eliminating waste from the body without accumulating pigments. But, if you are in the habit of constantly consuming large amounts of water, it may lead to kidney overload, as the kidneys are responsible for regulating the body's fluid levels. It's not that water is bad, but the key is balance. Sometimes, your body may be eliminating more liquid than necessary, which isn't necessarily good. What should you do when you notice your urine is excessively clear? The answer is moderation. Try adjusting the amount of fluids you consume throughout the day and observe the effects on your body. Clear urine can be a good sign, but it's essential to be aware of excessive hydration, especially if you're feeling uncomfortable or noticing symptoms like excessive fatigue. And, of course, if it persists, a doctor can help ensure your hydration balance is in check. What happens when urine takes on a stronger color, like orange? Have you ever come across orange urine and thought, this isn't normal? Don't panic, as this can be caused by some relatively simple reasons that are important to watch for. One of the main culprits is consuming certain foods, such as carrots, pumpkin, and especially excessive beetroot intake. These foods contain pigments that can temporarily change the color of your urine, giving it an orange tint. The good news is that this color change doesn't pose any threat to your health. When the intake of these foods decreases, the color returns to normal in no time. However, if the orange urine persists for longer, especially without having consumed foods that could cause this color, it's time to pay closer attention. In some cases, orange urine can be a result of medications, like rifampin or phenazopyridine, which are used to treat urinary infections. Although the effect is temporary and harmless, it's always good to keep in mind that medications can interfere with the appearance of urine. Therefore, if you are undergoing treatment, it's worth checking the guidelines on possible side effects. Now, what if the orange urine continues, and you haven't eaten foods that cause this or are taking any medications? In this case, the color might be caused by liver or gallbladder issues. In this scenario, it's important to see a doctor as soon as possible. What matters here is that orange urine, when caused by food or medication, shouldn't cause panic, but if it persists, it's always important to investigate further. And if the color starts to get cloudier, we already know what might be happening, right? Cloudy urine is a sign that shouldn't be ignored, as it may indicate various conditions that require medical attention. When urine becomes cloudy, it's often due to the presence of mucus, blood cells, or even pus in the urine, which suggests a possible urinary tract infection. This type of infection is more common in women but can affect anyone and is often accompanied by symptoms like burning during urination, frequent urination, and lower abdominal pain. If the urine is cloudy and you notice these symptoms as well, it's crucial to seek a doctor for tests and proper treatment. However, cloudy urine is not exclusive to urinary tract infections. In some cases, it may be caused by kidney problems, such as kidney stones or even more severe diseases affecting renal function. In these cases, the urine may not only be cloudy but also have a changed color and a stronger, unpleasant odor. The most important thing here is that, in addition to cloudy urine, you should also pay attention to other signs, such as back pain, leg swelling, or difficulty urinating. If you notice any of these symptoms, a visit to the doctor should be immediate. The good news is that, often, a urinary tract infection can be treated with antibiotics, and kidney stones can be resolved with dietary changes or even specific medical procedures. However, the most essential thing is to act quickly before the situation worsens. So, if you notice your urine is cloudy, especially if accompanied by other symptoms, it's critical to seek medical advice. Noticed that the color of your urine suddenly changed? Don't panic. The first thing to do is observe other signs from your body. Changes in urine can be a reflection of many variables, like diet, hydration levels, or even the use of medications. If you've consumed foods rich in pigments or taken medication recently, the color change may be temporary and of no major concern. But if the change persists and there's no obvious explanation, it's time to take a more cautious approach to your health. In any scenario, the first step is to observe, record, and if necessary, adjust habits like water intake and diet. Additionally, it's worth reflecting on what you're feeling beyond the altered urine. If the color change is accompanied by pain, fever, or fatigue, it's a sign that your body might be asking for help. Stay alert to these signs. You can start by taking simple measures, like increasing hydration, which can be an effective solution for many issues. Drinking enough water helps the body eliminate toxins and restore normalcy, in many cases, without the need for medications or more complex treatments. However, if after these simple changes, the urine color continues to be altered and you still feel uncomfortable with other symptoms, seeking medical advice is the next essential step. Don't put off what can be prevented now. Acting quickly is key to preventing small changes from turning into bigger problems. Now, with this awareness in mind, let's talk about the importance of self-care and how it can be a great ally in maintaining your health. The truth is that self-care isn't just about going to the gym or eating healthily. It goes much further, including the attention we give to the signals our body sends us, like changes in urine color. Observing these details could be the key to detecting health problems before they become something more serious. Taking care of yourself is understanding that, often, prevention begins in the little things. Your urine, for example, can reflect what's happening inside your body, and by monitoring it, you're adopting a health-conscious attitude. This doesn't mean being hypochondriacal, but rather an individual who cares about long-term well-being. When noticing any change, no matter how small, take the initiative to investigate what's behind it. Don't be tempted by the idea of, "it will pass on its own," because, often, quick action is what makes all the difference. And remember, the more you know about your body, the better prepared you'll be to care for it. Knowledge is your greatest ally. Be curious about what's going on inside you and seek answers. This is true prevention. Self-care isn't just about caring for yourself physically but respecting and understanding your body to promote a healthier, more balanced life. Now, you have the necessary tools to observe changes in your body more attentively and consciously. The next time you notice something different in your urine, remember that you already know what to do: observe, adjust, and if necessary, seek help. Take care of yourself because health is the greatest asset you can have. And, if you enjoyed this content and want to continue learning about how to keep your health in check, don't forget to subscribe to the channel and activate notifications for more essential tips. Let's go on this well-being journey together.